Luke and I have a contest on our podcast where we pick stocks and we challenge each other to come up with a better idea. And one particular thing that's important to know is that a great company does not always make a great investment. So it's maybe complicated in that sense. But I've been very jealous of Luke's investment in Intuitive Surgical
I'm
because
becoming quite jealous of it as well, actually.
yeah. Don't look at the chart, or I mean, he's done exceptionally well, and he's held it all this time, which is harder than you think. But I'm sitting there, thinking, well, it's already $194 billion. I'm too late. This, that, and the other thing. I need a little smaller play that's sort of close enough. And lo and behold, in my research, I found that the co-founder of Intuitive Surgical recently bought a large number of shares in Procept Biotics.
Robotics, yeah. Procept Robotics.
Yeah. And, from an investing standpoint, I'm obviously no surgeon. I know very little about this field, but when the co-founder of Intuitive Surgical buys massive amounts of shares, my thinking is he's certainly doing it for good reason. Yeah. He's not burning his money, and it's one of these. How familiar are you with?
So it's another robotic device I've used. So that's the difference about Procept Robotics is they have a robot which is used for one specific indication and one specific procedure. And that's to do benign prostate enlargement operations. So that they're basically coring a hole through the prostate, not for cancer, for benign enlargement to help men pass urine more effectively as they get older, all right, to stop those waterwork symptoms. What was previously done with a kind of hot wire, what was called a transurethral resection, or has been done with steam, has been done with a variety of other devices. This is like a high-powered water jet, which can be used with robotic application to core a hole through the middle of the prostate. And so that procedure is called the aquablation. The device is manufactured by Procept Robotics. I do that procedure as well, and so I do know quite a bit about it. It has had a huge increase in the UK. I can't speak for other markets, but in the UK, it's really creating waves, to use the water analogy, and is really doing well. And so, yes, I mean, and it has fewer side effects because it's water. It's not using heat. You get less damage to certain structures that help with ejaculatory function. And so one of the main problems with the conventional operations for benign enlargement of the prostate is that they cause problems with ejaculation. And for many men who are sexually active, even if they don't want to have more children, and fertility is not an issue, they still want to ejaculate normally. And so this procedure has much better outcomes in terms of ejaculatory function. It also appeals to the clientele of robotic surgeons because it's a robotic device. So the learning curve for robotic surgeons like myself is perhaps not that long. So they've also given the people what they want in the sense that they've created something that is good for the patient, but also is what the surgeon also wants to be doing as a robotically trained specialist. So they've kind of hit that sweet spot where it is appealing to surgeons and it is appealing to patients because of the improved outcomes it can have. So, yeah, I think I didn't know that the co-founder of Intuitive had invested in it, but I can see why.
Well, this is fantastic. See, you give us all your expertise, and we give you hot stock tips.
There you go.
And there is, by the way, Procept is actually also in the process of expanding into prostate cancer stuff.
Yeah, they're doing the randomized clinical trial about to start called Water 4, which is being led by one of my colleagues at the Royal Marsden, a major cancer hospital in the UK. And they're now looking to see whether it can be used for prostate cancer. But the reason I didn't mention it is because that's not what it is proven to work for. And I'm an academic after all, so that randomized trial will have to report before we can say that it can be used for cancer.
Right. Well, thank you. You're confirming my thesis, and now I get to make Badger Luke a little bit jealous of my upcoming thousands of % gains with this one.
You're getting like a microcosm of 105 episodes of the podcast, because I try to find these incredible world-changing companies that are mature, like they dominate their market, And Christoph finds these random little tiny things that are, half of them don't make any money, and then he's kind of rolling the dice. So hopefully you've had an endorsement from the expert here. This is a good one, Christoph.
Amen.